So again, I'm Erin Buck, and today's topic is the benefits of physical activity after cancer. I think in general, cancer survivors, and I'm speaking from being a personal trainer, of course, that those who come to see me don't expect that I have to be an expert on cancer treatment. However, they do expect that I understand the basic aspects of cancer treatment, which are commonly surgery, chemotherapy, and radiation. And in this Train the Trainers course, I think it's important to touch on issues and common treatments that our clients will face when they're exercising. Next slide, please. So this is just a few photos from, it warms my heart, from my second home, which I've been away from now for 6 weeks. These are some of my survivors who come and take advantage of our exercise programs at the Upper Valley Aquatic Center. Next slide, please. I think this chart does a really nice job of highlighting what we as professionals should be taking into account when developing an exercise prescription. As you can see, just so many of our systems are affected with it, in terms of cancer and also the treatment. So as far as our nervous system is concerned, common effects are peripheral neuropathy. Those are some of the things that I think about. Muscular, myalgia, cardiovascularly, we think about, there being a higher risk for those with pre-existing conditions and other comorbidities, such as CVD. Also, we think about insulin resistance due to hormonal treatments. That's a concern. As well as cardiotoxic chemotherapy agents are really hard on the heart. We know that lymphatic system is disrupted due to lymph node dissection surgery and also radiation. Our immune system, specifically from chemotherapy, immune suppression is something that we talk about a lot. So those are just some of those things that kind of I often, when I'm thinking about exercise prescription, come to the top of my list of when I'm thinking about working with this population. So go ahead and do next slide, please. There, sorry. All right. So the next question is, of course, how does exercise affect the body? And as we can see, this chart is an amazing representation that the improvement in quality life that has been reported with exercise interventions with breast cancer survivors, both during and following treatment, is extraordinary, right? We know that it works. Exercise has been shown to result in improvements in maintenance in both the physiological and psychological factors during treatments, such as chemotherapy and radiation. We do know that greater improvement is seen when exercise is undertaken following the completion of active treatment. I say that not to dissuade people from starting and or maintaining an exercise program during treatment, but we just have to have clear expectations about the anticipated response. And usually as a trainer, we want to align those goals with our survivors that we work with. Next slide, please. All right, so this brings us to, should we exercise? And I know that we know that the general population, we can all agree that everybody should be exercising. Cancer patients, should they exercise? A client in active treatment may have reduced tolerance for exercise on specific days, for example, the day of treatment. So modifications and an understanding that as treatment progresses, the exercise tolerance may decrease. But we do think in general, collectively, that working with patients during treatment can be very helpful and a positive for many survivors. And then also cancer survivors. So we know that regaining fitness takes time. We have to start slowly and aim for consistency with these individuals, and then, ensuring that the trainer monitors the response and alters the prescription as needed. And I think Mary was going to jump in with a few things to say on this one as well.
Yeah, thanks, Erin. So I just wanted to add, in terms of the part about cancer patients, should they exercise when they're going through treatment actively, like if they're getting their chemotherapy? And it is safe. In fact, it has been shown to help decrease side effects to chemotherapy. And the biggest side effect to chemotherapy is that it lowers the immune system. And that is most common about 7 to 10 days after their chemotherapy treatment, depending on what they're being treated for. So that's also when energy tends to be the lowest. So it's not actually right afterwards, but 7 to 10 days after. So that first week, they might be feeling pretty good. And that's a really good time to jump in and exercise. And fatigue is really common, which is counterintuitive to say that, well, when you're tired, you should exercise, but it actually does help. And so I work with my patients and try to figure out their pattern during their treatment. It often is very predictable once you get through 1 or 2 treatment cycles, which days they're going to have the most energy. And those are the days to take advantage of. And then that helps increase energy throughout the treatment plan. Thank you.
Next slide. So many of us as professionals have, I think, seen this before. But if you haven't, I certainly wanted to take the opportunity to show it to those who are just beginning programs. Generally, we like to outline getting both subjective and objective data on all of our survivors. I assume Megan or Ariel, you're able to click on that ACSM PARQ link to bring that up for people to see. But if you haven't seen a PARQ before, we wanted to go ahead and just show you what one looks like. Thank you, Megan. All right. So this is just, preventive measure, but also gives you the opportunity to start to have those longer discussions with your clients about their current situation and also their history, because I think that learning a lot about their history is going to be very helpful in terms of your exercise prescription. So we'll share those links, of course, in the with the presentation after, so we can go back to those. You can go ahead and click out of that, Eric. Sorry, Megan, thank you. Okay, good, yep, perfect. So additionally, we talk about the effects of cancer medication and treatments when designing an exercise program. So there's even more challenges that trainers need to be aware of. We talk a lot about thermoregulatory and vasomotor. So this is specific to body temperature changes and things related to hormone levels. We get into the musculoskeletal effects, joint pain. And also we talk a lot about, of course, bone health and how they're at higher risk for osteopenia and osteoporosis, and what we can do to, of course, work to prevent. Next slide, please. All right. So this graph was in a systematic review and meta-analysis by Kui, and it was published back in 2013. And what it looked at was the physical activity effect on ischemic stroke, breast cancer, colon cancer, as well as heart disease and diabetes risk. And they found that as the number of minutes of exercise a week increased, of course, the risk decreased. This study concluded that people who exercised several times higher than the recommended minimum had a significant reduction in the risk of the 5 diseases studied. Next slide, please. So we move to talking or discussing what type of exercise is safe and effective. And we'll just be really looking at 3 realms today, but flexibility and stretching, as well as aerobic exercise. And Mary touched on this. We know that aerobic exercise is known to decrease fatigue symptoms, both during and after treatment. For breast cancer population, we focus on also upper body, helping with weight loss and encouraging deep breathing, which in turn help, of course, the lymphatic system move along. And then also strength training and taking a look at the PAL trial, because it had found that slow and progressive strength training was both safe and for the breast cancer survivors who are at risk for lymphedema. And so we've put the link in the notes below so you guys can have access to that PAL study if you haven't read it before. But I think PALS in general has played a key role in overturning restrictive activity limits on people at risk for lymphedema. If you don't know a lot about it, the trial enrolled 154 women who were at risk for breast cancer related lymphedema. And they assigned them to either a program of slow progressive weight training, where they started out with very light weights, or no exercise. Among women who had 5 or more lymph nodes removed, the weight training made a difference. 7% in the intervention group experienced an incident of lymphedema versus 22% in the non-exercise group. Additionally, as part of that PAL trial, the research team completed a study with 141 breast cancer survivors who had stable lymphedema. And again, they were assigned to either a slow progressive weight training program, again, or no intervention. And women in the weight training group were found to not be at any higher risk for developing arm swelling. They also had a lower incidence of lymphedema flare-ups, which is important to mention. 14% in the group versus 29% in the control group. And this was, of course, assessed by a certified lymphedema therapist. Next slide, please. So we look at cardiorespiratory fitness recommendations. Generally, the frequency is 2 to 5 days per week. The intensity is 50 to 75% of predicted max heart rate. The type, and generally what's recommended is walking, but there's also a lot of other aerobic activities that generally fuel people's sense of joy and productivity. Time is anywhere between 10 to 60 minutes per session, and the duration of any program is generally 6 to 26 weeks. I think something to mention here is that timing of the intervention matters, right? So whether it's during or after cancer treatment may affect the degree of cardiovascular improvement. And we touched on this a little bit, but when we think about those clients who are still in active treatment, and that they have a reduced tolerance, the day of treatment or the days immediately following a treatment session, is something that we pay, attention to as professionals who are providing exercise prescription. So generally it has to be modified on those days. When we talk about those who are doing cardiorespiratory fitness post-cancer treatment, I think often people would like to get back to those activities really quickly. And for me, a constant message is trying to tell them that regaining that fitness takes time, right? And so that we always start clients' programs slowly, while we monitor their response. Next slide. Muscular strength and endurance recommendations. So resistance training has been effective in improving both endurance and strength in the cancer population. Most of the research done to date has been about breast, but also prostate and head. Frequency, 1 to 5 sessions per week, with a kind of notable mention of 2 to 3 is really what we'd like to see people do. Number of exercise, it generally varies, but we try to involve large muscle groups. Sets would be 1 to 3, repetitions 8 to 12. Intensity is generally somewhere between 25 to 85%. And then again, the duration of program is 3 to consistency over time, which equals out to hopefully, always. Next slide, please. Okay. So I think many of us believe that the exercise is the secret weapon. And how does it help? Well, it provides a social outlet. Exercising with others motivates us and makes us feel part of the group. It generally helps to reduce stress, as well as empowers us to take control of different aspects of our life. It certainly, I think, encourages us to rest more soundly. It aids in boosting one's confidence and morale. And overall, it makes us stronger, physically, mentally, and emotionally. So I've had the pleasure of working with Liz for, I want to say 3 years, but it could be longer. Liz, I should have checked that data with you before. Liz Shellhorn's one of our patient advocates, and I thought that it would be terrific to invite her in on today's presentation to have it kind of, a presentation from somebody who is a survivor who can really speak to when we talk about all these recommendations, how they apply and what worked for her. So Liz, I'm going to have you take it from here.
Thank you, Erin. So I am Liz Shellhorn. I am a breast cancer survivor. And yes, I met Erin, I guess it was a little about 2.5 years ago. So I started out, I was not your typical patient in that, or maybe yes, typical. I was in shape, I ate healthy, I exercised before. And I was just one of those unfortunate folks that went in for a test one day and came out with a cancer diagnosis. And mine was caught early, but it was aggressive. So I had the whole 9 yards. I had surgery, I had chemo, I had radiation, and now I'm halfway through a 5-year program of hormone therapy. I did exercise through treatment. I found it was much better for me if I could get outside. I had a pal that had been through it earlier, a couple of years earlier, and she said, you have to get out every day. Breathe the fresh air, be in the sunshine, it will make a difference. And it really did make a difference. So probably about 12 months into treatment, I had a couple months left. I started looking at, I'm not where I was when I started this. How am I going to get back to where I need to be when I finish treatment? So I began to look around and I went to a lot of different gyms. And this is what I found when I finished treatment. We go through a stepped program, all of our treatments, what to expect every day, how to deal with all the side effects. And then it comes the day you're finished treatment. And you're sent on your way. And I think we all ask, how do I get back to where I was? How do I get back to what's normal? And it's always, you're not going to get back to where you were. It's a new normal. I hated that phrase. I still hate that phrase. And I felt lost as to how do you get back to a new normal? What is a new normal? So I looked around and I was very fortunate that I found Erin, and Erin was great, sat down with me early, and she understood what I was looking for. And I was looking for a multi-step program. I had been in the gym before. I knew how to eat right, but I was at a totally new place that I had never been before. And I needed to start at square one. And I needed somebody that understood that much better than I did, because I didn't understand why I couldn't just go back into the gym. And I went to physical therapy and she said, you have to be careful. And it is a stepped program. And what did that mean? And so I needed a professional that understood where I had been and what my challenges were. So I looked for a stepped program, because it doesn't matter what kind of cancer treatment you've been through, whether you were somebody that was in the gym before, had never been in the gym before, or severely overweight, you're basically all starting out at square one. And a stepped program where you begin really at the beginning with maybe no weights. Maybe it's not walking on the treadmill for a mile. It's baby steps. And you need a lot of encouragement for those baby steps, because you are different. Your brain doesn't work as well, your body doesn't work as well, you're not sleeping as well. Fatigue, I thought fatigue was you're very sleepy. Fatigue is, I'm too tired to do anything today, to even think about anything today. So I started with a stepped program was very important to me. I looked for something that was going to help me with my fatigue, with lymphedema, with my mobility, with my range of motion. I needed a program that would talk about what is exercise. They say exercise reduces the risk of recurrence. But what is exercise? What does that mean to me? And what does it mean to the next person next to me? Maybe is much older than I am, maybe is much younger than I am. And I needed a program that would be flexible. If I go into the gym and they say, lay on your stomach and do this, that was a no-go from the very beginning, where maybe one of my training partners, that wasn't an issue for them. And it was a safe environment for us to get together and talk about those things. So we worked with Erin, and Erin explained to us the difference in heart rates and how what may push my heart rate into those levels is different for me than the next person. How to vary your activity levels and vary the activities to make them fun and make them interesting. Why is strength training important? It's not just about walking, because you've spent a lot of time on the couch, you've spent a lot of time in the hospital, you've lost a lot of muscle mass, and it doesn't come back easily. Stretching is very important. Physical therapy. We worked on relaxation and breathing techniques, which helped relax the body, helped you sleep better, helped you relax, helped with the fatigue. And also, how do you nourish the body? Your body has been through a lot. Your brain has been through a lot. So what are the good foods to eat? Some of the things that I thought I was eating healthy, I wasn't necessarily eating healthy. So it was an all-encompassing program that really helped me get back to what that new normal was. PALS it's a community of women. We share recipes. We encourage each other on both the good days and the bad days. Erin shows us that some days we'll be able to do things and maybe the next week we can't. They say radiation is the gift that keeps on giving. I laughed at that initially, but it is true. You think you're all stretched out and things are just working great, and then you hit a time that things just don't work so well anymore. And you need a lot of encouragement, and you need those baby steps along the way, and to have your hand held. It's an exploration of outside areas to exercise, and to support each other through the good times, the bad times, the relapses of your friends and neighbors that are with you in this program. And it's working with a trainer who is credible. They have the training, they have the knowledge of the lymphatic system, and they can give you all the pieces of where you need to be and how you get there. I think the biggest thing is, as I look around the group of, I think, Erin, it's probably anywhere between 8 to 10 women now. We are all breast cancer survivors, but we are all different ages, all different abilities. And sometimes it takes Erin, sometimes it's a partner that will say, hey, 2 months ago, you couldn't do this. 6 months ago, you couldn't do that. Look where you are now. Or here are some new challenges. Here are some things that can help you out. But I think a stepped program, as I like to refer to PALS, your treatment gets you to your destination, but your exercise program is really what gets you back to your new normal. And that, to me, is as important as the treatment that you've received in trying to get your life back.
Thank you for sharing, Liz. I think it's such an important part of also your recovery is sharing your story. So thank you. So in summary, research suggests that physical activity is generally safe and effective for all cancer survivors. Promotion of physical activity among the cancer survivor population is particularly important because physical activity levels tend to decrease around the time of diagnosis. And the goal of prescribed physical activity and associated prescriptions will differ among treatment, timing, the type of cancer that you have, and also acute or long-term side effects. So I think I'll hand it to you, Grace.
All right, thank you, Erin, Liz, and Mary.